Hello, my name is Denise Aguilar. Today I'll be recording the parenteral medication administration checkoff. So I'm going to go ahead and begin. First, I'm going to check the MAR against the doctor's order for accuracy. Then I would check for any allergies, contraindications, drug-drug interactions, drug-food interactions. And then I would want to check for the appropriateness of the drug. So for example, if my patient was diabetic, it would be appropriate to be giving the patient insulin. Next, I want to review any assessment or lab data that might influence administration of this drug. So for example, if I was administering an opioid, I would want to assess respiratory rate. So now I'm going to go ahead and prepare the medication. So I'm going to perform hand hygiene. And I'm going to make sure to only focus on preparation of one medication at a time so I can avoid any distractions and error. So I'm going to go ahead and use the MAR to pull out the correct drawer. And then I'm going to use the MAR to make sure that I pull out the correct medication. So this would be the first check, and I would also want to observe the 7 patient rights. So that would be the right patient, give them the right drug at the right time, in the right route, via the right route, in the right dose, for the right reason, with the right documentation. Okay. So I also want to check the expiration date. So this says the 1st of July 2021, so that's okay. After I've done that, I'm going to go ahead and perform the dosage calculations to determine the correct amount. So I would do my dosage calculations, and then after that I'm going to select the appropriate syringe and needle. So this is going to be an IM injection, so I want to select a 22 gauge needle. A 1 inch would be fine since my patient is a normal build, and I'm going to select a 3 milliliter syringe again because this is an IM injection. So I have that here. I'm going to have to switch out. I'm going to have to switch out the needle later on because this is a 3/4 inch needle. So now that I've done that, I'm going to go ahead and draw up the medication. So I'm going to go ahead and clean the top of the vial with an alcohol swab. And then, so for this checkoff, I'll say I'm going to be giving the COVID-19 vaccine, 0.5 ml. So I want to withdraw about 0.5 ml of air, so I don't form a vacuum in the vial. I'm going to go ahead and inject the air and withdraw a little bit over 0.5 ml. And I'm going to put the window facing myself. And I'm going to get rid of any air bubbles. Okay. I'm going to go ahead and recap the needle using the scoop technique so that I can switch out the needle. So now that that's ready, I'm going to go ahead and create a medication label. I want to be mindful not to contaminate the needle and the syringe, and I'm going to go ahead and recheck my calculation by doing it one more time. So I would do the calculation one more time, and then so again it's the same as my previous one, so I can move forward. And this is also where I want to perform the second MAR check. Okay. So now I'm ready to go ahead and see the patient. So I'm going to take my syringe, the MAR, and some alcohol swabs. Okay. So I'm going to go see the patient now. I'm going to go ahead and perform IPI. So hello, my name is Denise. I'm going to be your student nurse today. I'm going to go ahead and close the curtain or the door behind me to provide privacy. And I'm going to identify the patient. Hello, may I see your hospital wristband? And can I have you state your name and date of birth? Okay, great. I'm going to explain what I'm going to be doing. So today I'll be giving or administering the COVID-19 vaccination. Do I have your permission? Yes? Okay. Thank you. So I'm going to go ahead and apply sterile gloves. And at this point, I'm going to do the third check against the MAR, and everything seems to check out. I'm going to go ahead and select the appropriate site. So for the IM injection, I'm going to use the deltoid muscle. The appropriate landmark would be the acromion process. So I would use about 3 finger width below the acromion process, and visualize an inverted triangle. At the center is where I want to give the injection. So I'm going to go ahead and clean the site. And before doing this, I would have checked the patient's ID, but I did that during the IPI. So I'm going to go ahead and proceed. Oh my god. So I'm going to go ahead and clean the site using a spiral motion going outward. I'm going to try to clean a good amount of area. Okay. I want to explain to the patient this vaccination will help your body provide or create antibodies that will help or protect you against the virus if you were to become infected. So I'm going to go ahead and I'm going to use the Z-track technique, and I'm going to hold the needle about an inch away, hold at a 90-degree angle, and I'm going to insert the needle. I'm not going to aspirate, I'm going to release the tissue, and inject the medication, and then I'm going to release, and I'm not going to massage the area. I'm going to engage the safety, discard the needle in the sharps container, and I'm going to go ahead and make the patient comfortable. So I would put the gown back up, anything to make the patient comfortable, and then discard any trash, and lastly document the medication given accurately. And that's